Most people keep asking us, what is the cost of dental treatments in India? We have calls coming up from patients asking for what is the cost of a root canal treatment, what is the cost of laser treatment, flap surgery, implants. Today in this video, we will talk about various dental treatment costs in India. Hi, I am Dr. Sridhar Reddy, practicing dentist for the past 20 years at Happy Dental Hospital, Nellore. There are two types of diseases which we most commonly treat in our dental office. First thing is dental cavity. Dental cavity, usually when you see a tooth has an outer protective enamel layer, inner dentin layer. Inside that, it has nerve supply. When the cavity of the tooth is in the outer enamel and just gone into the dentin layer, you can do the treatment by a filling, simple filling, removing the cavity and restoration by a filling. This filling usually costs between 500 to 2000 rupees. Then, second stage of the cavity. Once the cavity spreads into the nerve supply of the tooth, the treatment becomes little more extensive, like you need to do a root canal treatment, need to give a permanent filling, take x-rays. The cost of all this usually costs from 6,000, 7,000 rupees to 10,000-15,000 rupees based on the crown you go for. Then in the third stage, once the tooth is badly gone, the cavity has eaten away almost all the tooth. At this stage what happens is you will have to remove the tooth, extract the tooth, go in for an implant or going for a bridge. Bridge or an implant usually costs for somewhere between 9 to 10,000 to it may extend up to 40-50,000 based on the implant you go for and the crown you go for on that, which in detail I will be explaining later. These are the treatment costs for dental cavity. Then you have the other disease which we most popularly treat in our dental office is gum disease. Gum disease, it will be usually plaque and calculus, just dust around the gums and teeth. We just do cleaning and polishing which may cost around 1,000 to 2,000 rupees. Suppose you delay this at this stage, the plaque and calculus enters into the gums, it causes gum infection, gum bleeding. Disease is called gingivitis. For this, usually we do deep curettage or laser curettage, whatever you call it. The cost of this varies from 15,000 to 25,000 usually. The next stage of gum disease, the final stage of gum disease usually is the gum disease spreads into the surrounding bone of the tooth. At this stage, we need to do a flap surgery combined with bone grafts or membranes. All this will cost around somewhere around 40-50,000, even 60,000 it could cost, because the disease is called periodontitis and it involves all the teeth and bone. So you have to replace the bone, give bone, artificial bone and all these things. Both these gum diseases can be prevented by yourself. You don't need to come to a dentist. 90% of the diseases are usually preventable by proper brushing at home. So proper brush, toothpaste and floss, it hardly costs 200 to 300 per month for you. The cost of dentistry is not very expensive. Your negligence, as you neglect the treatment, you come late to the dentist. This is the reason for the increased cost of dental treatments.